Have you been trying to have a baby but it's not happening? The problem may not be what you think, and the solution might be simpler than you've been told. Hello, I am Dr. Aniku, a gynecologist. Welcome to Women's Health and Fertility, where we discuss important topics about women's reproductive health. Today we are diving deep into a topic that affects millions of women worldwide, but is still misunderstood, stigmatized, and often delayed in diagnosis, and that is female infertility. If you've been trying to conceive, planning to, or simply want to understand your body better, this video is for you. So what is infertility? Infertility is defined as the inability to conceive after 12 months of regular unprotected intercourse if you are under 35, and after 6 months if you are 35 and above. But here's the truth many people always ignore. Infertility is not just a woman's problem. About 40 to 50% of cases involve male factors and many involve both partners. Today we shall focus specifically on female infertility. What causes it? How we investigate it? And what can be done? 1. The ovaries must release a healthy egg. In other words, ovulation has to occur, right? 2. The fallopian tubes must be open to allow sperm and egg to meet. 3. Fertilization must occur. 4. The embryo must travel to the uterus. 5. The uterus must support implantation. If there is a problem at any of these steps, it can lead to infertility. Let's start by discussing the steps of pregnancy. For pregnancy to occur, several things must go right. There are a number of causes of female infertility. First is ovulation disorders. This is one of the most common causes of infertility. Conditions causing this include irregular ovulation hormonal imbalance, polycystic ovarian syndrome. Often the patients will present with irregular or absent periods. Some have acne, excess hair growth, and difficulty predicting ovulation. 2. Blocked fallopian tubes. If the tubes are blocked, sperm cannot meet the egg. Common causes: previous pelvic infections, sexually transmitted infections, previous surgery, and endometriosis. 3. Endometriosis. This is a condition where tissue similar to the uterine lining grows outside the uterus. It can cause severe pelvic pain, distort reproductive organs, affect egg quality and implantation. 4. Uterine problems. Examples include growths like fibroids, polyps, abnormal uterine shape. These can interfere with implantation or pregnancy growth. 5. Age and egg quality. Age is one of the most critical factors. Fertility starts declining after age 30, drops significantly after 35. By 40, chances are much lower. This is due to reduced egg quantity and quality. 6. Lifestyle factors, often underestimated but very important. For example, smoking, alcohol, obesity, or being underweight, and chronic stress can often disrupt hormones and ovulation. 4. When should you seek help? You should see a gynecologist if you have tried to conceive for a year, if you are under 35 years, and for 6 months, if you are 35 years or above. Also consider seeing a gynecologist. Your periods are irregular or absent. Thirdly, you have known conditions like fibroids or endometriosis. Lastly, if you have had pelvic infections or surgeries, early evaluation can save you years of frustration. 5. Tests for female infertility. A proper fertility workup is structured not a guesswork. 1. Ovulation assessment, which involves hormone tests and ultrasound tracking. 2. Pelvic ultrasound to check ovaries, uterus, fibroids or cysts. 3. Tubal patency test. Commonly performed tubal patency test is hysterosalpingography. It helps to check if the fallopian tubes are open. 4. Hormonal tests. Commonly performed hormonal test includes thyroid function test, prolactin, ovarian resolve tests. 5. Laparoscopy if needed. Laparoscopy is used in complex cases to diagnose endometriosis and adhesions. Important truth we have to know is a complete fertility evaluation is never complete without testing the male partner. Ignoring this leads to delayed diagnosis and unnecessary treatments. 6. Treatment options. Treatment depends on the cause. 1. Ovulation induction. Medications for ovulation inductions help stimulate ovulation. 2. Lifestyle modification. Sometimes weight loss or stress reduction alone improves fertility. 3. Surgeries help to correct fibroids, blocked tubes, endometriosis. 4. Assisted reproductive techniques, intrauterine insemination, where sperm is placed directly into the uterus. IVF, also known as in vitro fertilization, involves combining eggs and sperm outside the body. Once there is fertilization and evidence of growth, then the embryo is transferred into the uterus for implantation. The reality is, infertility is not just physical feeling, but it is also emotional. As such, many women experience anxiety, depression, social pressure, isolation, and mothers need to know they are not alone. And seeking help is not weakness, it is strength. What you need to know, infertility is common and treatable. Early evaluation improves outcomes. Age matters, don't delay unnecessarily. Both partners must be assessed, and there are multiple treatment options available. If you found this video helpful, like this video helpful, drop your questions in the comments. I personally review and respond. Subscribe to Women's Health and Fertility, no nonsense guidance. And most importantly, if you've been trying without success, don't wait. Seek professional evaluation early. Your fertility journey is unique. With the right information, support, and care, many women go on to achieve successful pregnancies. I am Dr. Aniku, and I'll see you in the next video.